Thank you. We are now going to demonstrate how EMR for Doctors makes it easy to enter patient notes. This is an example of our PC-based version. We also have a Pocket PC version and a web-based version. So once we pick the patient, we would go to Patient Notes. At this point, we would pick the date of service. At this point, we can also duplicate a prior visit so that you can just change what's different and save a lot of time. So we would confirm the date of service here. Now, you can pick a body part, and that will narrow the choices to that body part. For example, we could pick low back pain, and it'll change the complaints to that area of the body. If there's not a choice in there that you need for that part of the body, you can go to Edit right then as you move through the program and add a new choice. Then you can use it immediately after you save it. So we choose the different choices here. Now severity can be a word or it can be a number, which means it could be graphed. On these we can choose 1 or we could choose ++ in case we want to choose more than 1. Again, we can edit this list. Okay. Now, if we save the note, we can put the type of note. Okay, let's see what we've done so far. There's more we can do, but this is just a quick note with their complaints. Okay, here's some spelling error, so we can correct that. And you can see it's already written, takes the notes and puts them into narrative style, so it looks like dictation. Okay, now let's go back and see other choices. Let's say they also have another problem that we want to record before we start doing the history and exam. So let's pick, let's say, neck pain. So we would choose a new note. So we start blank, then we choose upper cervical, side, midline, radiating, severity, frequency, type of pain, what makes it worse, and what makes it better. Now, if that's the last of the complaints, we could go right on and do the history, like maybe it was from an accident. And again, you can pick more phrases. You can put past medical. These are choices here. You see if it has brackets, that means you can pick from a list. So you can have a list within a list. Now let's see what we've done so far. If we go to output chart, again, it'll take both of the notes and combine them into one output chart. Again, let's go back and add more to it. So actually, we can do unlimited complaints. You see, they'll just list together for that date. So you can have there's no limit to the number of complaints. Now, on objective findings, same idea as the other areas. You can pick different exam findings that are positive. You can also have see if this one has it. You can have a bracket list here too. So it'll ask you a choice. See, only the ones with dots are the ones you have to answer. See how it will put the answer there. You can have other prompts too. We'll give you information on that. You can also do live vital signs or custom exams, or even include Excel. Then we have radiology, other findings, Assessment would be the diagnosis, and because everything will be combined into one chart node for the day, unless you put a different time of day, you can combine all of the exam findings and all the diagnoses and the plan because it's going to end up in one place. In other words, you only have to save it in one of the notes for the day. So it's still saying it's on the lumbar region, but we can accept that. We can go to the cervical region and pick a diagnosis for that area too. Now we can go to the plan and we can pick from our plan. Now this would be your own way of doing business. In other words, the way you practice in your practice. So again, you would want to change these to match the way you do it. You could just easily add right here. You can add or take away the things that you want for your plan items. We also support doing a prescription so that you could pick a prescription as part of your plan. So we could pick from our favorites. And then okay. Okay, now we pick a prescription item, then we would go ahead and put the amount and pass it back into the file. You can also handwrite a prescription that way too. Okay, back in the notes. We can also do comments besides the plan, and we can pick fee items as we do the plan also, and they can be saved to the note so that when you get to accounting, the fee is already there. Now we have another way to enter notes, which is called the Power Panel notes. In other words, you can see the whole note in one glance. So we have the complaint, the side, the type of pain, and then we can have the plan and everything, all in one visual. So you can also graph, it'll graph the pain, and you can also graph other items like the height, the weight, the respiration, the pulse, blood pressure, and you can change these and graph other figures that you may want to collect. There's another way to do notes, and that would be just drawing. In other words, you could draw pain. Let's take one that we've done before. And let's do a new body drawing. And we could just, let's see, actually draw here. You can draw right on the screen if you have a touch screen. You could make notes over here, or you could switch this to a form. You know, you can edit this and create a form that you would rather load and scribble on. And then later you could change your handwritten notes into regular notes. We also have other body parts, so you could make notes right on the body part. So let's say with the ankles. So you could make notes right on one part of the body. Okay, we also have alerts. and we can also capture dictation. Thank you for reviewing our note system. Okay, can we see what we're doing?